Welcome to the 40 Years of AIDS exhibition, made by UNAIDS Indonesia. In this video, we invite you to enjoy a trip to our exhibition virtually. This exhibition is located at the UNAIDS Indonesia office in South Jakarta. The 40 Years of AIDS exhibition is the only exhibition in Indonesia that provides information about the global and national history of HIV and AIDS to visitors. This exhibition is made up of 3 sections. First is the timeline section, followed by the community story section, and last but not least is the community campaign section. Let's start in the timeline room, beginning with the first HIV case found in the year 1981 in the United States. Back then, these first cases were labeled as a gay-related disease. In the year 1983, Dr. Zubairi Jurban conducted research on 30 transgender women in Jakarta, Indonesia, and concluded that 2 among them are likely to have AIDS due to their clinical symptoms. In 1987, the first case of AIDS in Indonesia was officially recorded in Bali, namely a Dutch patient who died at the Sanglah Hospital in Bali. Towards the end of the 80s, there was mounting pressure from activist groups around the world, such as the ACT UP campaign that demanded the US government to find treatment for HIV. The high level of stigma on HIV at the time also coincided with increasing solidarity and support, including from high-profile figures like Princess Diana. In 1988, December 1st was officially set as World AIDS Day by the World Health Organization. And in 1991, the red ribbon became the symbol of solidarity to AIDS. Now we enter the 90s. In this decade, you will see that more institutions were established to respond to HIV. In Indonesia, for example, the National AIDS Commission was established. Not just that, but the activist movement for HIV continued to build and grow, including here in Indonesia. Susana Murni, the first Indonesian person living with HIV to go public with her status, was one of the figures that came out of this activist movement. She eventually founded Spiritia Foundation, which still stands strong today as a community organization on HIV in Indonesia today. Despite her declining health, Susana gave a keynote speech at the opening of the 6th International Congress on AIDS in Asia and Pacific in Melbourne in October 2001, and she gave a powerful speech entitled Breaking Down Barriers. She passed away shortly before the opening of the 14th International AIDS Conference in Barcelona, Spain, in July 2002. Now we come to the year 1996, when UNAIDS was first established. In that same year, Indonesia also held its first AIDS Candlelight Memorial. In this decade, we start to see more progress related to HIV treatment. By this time, the AZT drug was already available in Indonesia, but sadly, the prices were not affordable for people living with HIV. Entering the 2000s, the Global Fund to Fight AIDS, TB and Malaria was created, and Indonesia received its first Global Fund grant in 2003. The availability of antiretroviral treatment became more and more available in Indonesia, with ARV by local pharmaceutical company Kimia Pharma. In this decade, you will also see that there is an increased commitment from the government to provide subsidized ARV, even though at a limited amount. In 2006, Indonesia saw more networks of key populations and people living with HIV organizations being formed. In the same year, the Indonesian government announced that Papua, which is the most remote area of Indonesia, has a generalized HIV epidemic affecting the general public. On to the 2010s, UNAIDS has a new vision, namely the 3 zeros: 0 new infections, 0 AIDS-related deaths, and 0 discrimination. In this decade, more and more people were on HIV treatment, and with that, there was increasing evidence that people that are on treatment will not transmit the virus to others. This finding about treatment as prevention is what would later be known as the U equals U principle, or undetectable equals untransmittable. In 2015, the WHO recommended pre-exposure prophylaxis, or PrEP, as a prevention option for HIV-negative people. Back in Indonesia, in 2017, the National AIDS Commission was disbanded, and its responsibility was transferred to the Ministry of Health. On a positive note, the Ministry of Health and HIV and key population communities in Indonesia launched the Saya Brani campaign to be an educational platform and promotion for HIV testing. Not only that, but new technologies were also used to reach more young people through the Tanya Marlo chatbot and campaign. However, stigma and discrimination against people living with HIV, key populations, and sexual and gender diverse groups is still very high. To respond to this, UNAIDS Indonesia, Arus Pelangi, Community Legal Aid Institute, GWL INA, and Sanggar Suara formed the Crisis Response Mechanism Consortium, or the CRM. The CRM Consortium works to mobilize support and advocate for the protection of sexual and gender diverse groups in Indonesia. Heading into 2020, the world was faced by the COVID-19 pandemic. This situation also led to the acceleration of innovations and policies that ease access for services to people living with HIV, such as the provision of ARV delivery, multi-month dispensing of ARV, TLD, PrEP, and more. At the end of this hallway, you will see that we have set up a room dedicated especially for the community. We made this special exhibition room to knit together stories of people living with HIV and key populations into what we call the community stories. Here you will see 30 photo stories that describe the experiences and lives of people living with HIV and key populations, with various struggles and how they rose above the difficulties they face, from stigma and discrimination to violence. The hope is that with the Community Center's exhibit, we can be reminded to never leave anyone behind in the response to HIV. Next is the last part of the exhibition, namely the collage showing community campaigns throughout the years. This exhibition would not be possible without the contribution from HIV community partners in Indonesia. The wall is dedicated to the communities with the slogan, "Communities will end AIDS," reminding us that the 4 decades of the HIV epidemic has shown that communities leading and being involved as an equal partner ensures an effective response. Here you can freely read and learn about a variety of information related to HIV prevention and response from leaflets and booklets donated by at least 12 community organizations, from organizations working on children living with HIV to communities of sexual and gender diverse groups in Indonesia. Of course, you cannot leave the exhibition without taking a photograph in front of the End Inequalities photo wall. And before you go, don't forget to write a message showing your commitment to ending AIDS by 2030 alongside other visitors. Thank you for virtually touring our exhibition. We look forward to welcome you in person at the 40 Years of AIDS exhibition in Jakarta.